So it's just a flesh wound. Let's go to IST-3. This study's straight garbage. This is an unblinded study that started blinded and nearly proved the exact thing that they've always said they didn't want to prove, which was that TPA doesn't work. They basically made up an ordinal analysis. They got a statistician to sign off on this for God knows what reason. Basically changing, saying, you know what? I know that we recruited thousands of patients and said that this was what our study was going to be. We're going to instead disregard all that and then put people in ordinal boxes. We don't have time to talk about that, but basically put people in shoe boxes of these are good outcomes, these are bad outcomes. Turns out that the way that they chose to make their cutoff was the only statistically possible way to actually get a positive study out of this unblinded study. You can only have one primary outcome, okay? You don't get to change it. If something comes up and you're like, oh, whoops, sorry, I don't like that primary outcome, you have to do a new study. I'm sorry, that's how science works. If you report it and say, oh, look, this trial's negative, but look, there's this really promising trend, let's do it again, you can do that. That's fine. That's statistically valid. But they basically just changed the primary outcome. So this is the Oxford Handicap score. It's a commonly used scoring system that says how sick you are. The lower you get on this chart, the worse your life is. So this was IST at 6 months. And where they chose to cut off at the 0, 1, and 2 is the only one that actually works. If you change that goalpost anywhere else, okay, so if you cut it off above 4, cut it off above 5, cut it off above 1, it doesn't work. Another thing is, unbelievably, in an unblinded study, one of their exclusion criteria was basically willingness to believe. So in order to get into the study, I cannot believe this got by people. You had to both have the patient and the provider believe that the person would benefit from the TPA. And who reported the outcomes in this unblinded study? The patient did. So in order to get into this study, you had to say, I believe TPA would help me. And then when they asked you, knowingly receiving TPA, several months later, did you get better? You have to be willing to say yes. This is the dumbest study design I've ever seen. They actually started off randomizing the drug. Genentech pulled their funding so that you couldn't pay for the drug anymore. And it's really smart that they did, because the initial results were actually trending towards TPA not only not working, but actually harming people. So the first few hundred patients were actually randomized and blinded, and there was a strong trend that didn't quite reach statistical significance yet, that it was actively hurting people. Then once it went to the unblinded part of the study, oh look, it works. So the placebo effect, hugely problematic here. And then they changed the hypothesis, like we mentioned before. It's the only way. You also have an issue here that before, people kept saying with those old trials that were negative, you know what? They're negative because you're treating too late, okay? If we get to them early enough, it'll be okay. And that kind of made sense. You know, the earlier you treat it, we certainly saw that with the heart attack data. But here you have a problem. This study specifically focused on the 3 to 6 hour range. It was looking at people that didn't meet the criteria for the other ones, so older folks, things like that. It turns out that the one group that had a worse outcome was that 3 to 4.5 hour population. Weirdly enough, over 4.5 hours to 6 hours, they actually had better data showing that it helped, which makes no freaking sense. And it really challenges the ECAS-3 data, which was that exact population. So your one decently done study that I actually think has any modicum of being positive in favor of treatment is the one that got beat down by IST-3 in this unblinded study. It doesn't make sense. There's no trend towards what works and what doesn't. So you got 3 studies out of 12 that are remotely positive, deep problems with all of those, and only one of those 3 are anything that I would remotely call positive. No Lazarus effect whatsoever in the literature, and contradictory results within their own literature.